I only give ibuprofen. All these invasive surgeries. Yeah, go ahead. It changes. This is from the StellaLife. So they used to have higher dose, and we used to give it AM and PM. And some patient complained actually because it has also vitamin C. And if you take high dose vitamin C, the patient will have diarrhea and very upset stomach. And there's a threshold. So now they have new product. It's lower dose and it's more and it's once a day. So. And also I want to mention StellaLife. I've been using StellaLife for the past 5 years now. I no longer use chlorhexidine in my practice. That's also controversial, but there's many studies showed that it might slow down the fibroblast activity and the healing. So I like to go more natural, and we use the kit. So basically I give this to the patient 3 days before, and it's a mouthwash and gel and also spray. So we call it the 3-3-3. It's 3 products, 3 times a day, 3 days before. And this will establish good environment to do these procedures. Now, funny story, when I used to give chlorhexidine, I used to always receive phone call from my patient 2 days after the surgery. Hey doctor, do we still have to finish that mouthwash? I'm like, why? Like, it doesn't taste good, staining my teeth, and you know. I'm like, no, it's okay, salt and water is fine. When I start using StellaLife, I no longer receive that phone call. When they come back for the 2 weeks follow-up, the question is, doctor, can we use this longer? We kind of like it. And the answer is yes. They can buy it from Amazon, they can buy it from me, it's available. Pain management. I don't even remember last time I gave Vicodin or Percocet. This has been my protocol since I heard about it the first time from Michael Picos, and I adapted that right away.